Infection Control in Healthcare, Part 2. Aseptic Techniques. Asepsis is the absence of disease-producing microorganisms. Sterile means free of all organisms. Contaminated means any object or area that may contain pathogens. Common aseptic techniques are hand washing, good personal hygiene, use of disposable gloves, properly cleaning instruments and equipment, and thoroughly cleaning of environments. Antisepsis is to prevent or inhibit growth of pathogens. It's not effective on viruses and spores. It can be used on skin, and examples are alcohol and betadine. Disinfectants destroy and kill pathogens. They are not effective on viruses and spores. They can irritate and damage the skin, and usually used on objects. Example, bleach. Sterilization destroys all microorganisms, including spores and viruses. Use of steam under pressure, gas, radiation, and chemicals on objects are common ways to sterilize. An example is autoclave, which uses steam under pressure. Bioterrorism is the use of microorganisms or biologic agents as weapons, which infect humans, animals, or plants. They have been used over time by many different nations, not only in war, but also on innocent people. Microorganisms are suitable for bioterrorism because they are inexpensive, available, easily produced, they spread quickly and maintain survival, they bring death and disability, and are transmissible from a person to another, and are difficult to prevent or treat. Many diseases can be caused by bioterrorism. For example, smallpox is caused by the variola virus. There's also anthrax, plague, botulism. Botulism can cause paralysis. And also tularemia, which is an infectious disease from bacteria. And also hemorrhagic fever, which the most common one could be Ebola. A bioterrorist attack could cause an epidemic and a public health emergency. It would have a huge impact on healthcare facilities. Social disorder could ensue, and a comprehensive plan is needed to prevent it. Therefore, the Bioterrorism Act of 2002 was developed and involves local, regional, state, and national governments. The goal of this act was for surveillance for early detection by communities, public notification when high-risk situation is detected, infection control measures and public education, funding for research or study of pathogens and developing vaccines and treatments, guidelines and restrictions on purchasing and transport of pathogens, to provide mass immunization if necessary, protection of food or water supplies, train personnel to diagnose and treat outbreaks, emergency management policies, criminal investigation of potential threats, preparation of healthcare facilities in dealing with an attack, and preparing to isolate facilities, and efficiency of communication. As healthcare workers, it is important for everyone to prevent infection transmission. The most important way to prevent spreading diseases is washing your hands. So why is washing hands so important? Well, it's a major aspect of standard precautions. It's the most important aseptic technique, and it's the most effective method of infection control. Your hands are perfect. So how do you wash your hands? Well, you use soap and warm water. Warm water is less damaging than hot water, and it produces a better foam than cold water. Also, use friction And clean all hand surfaces, so the palms, the back of your hands, between the fingers, and also underneath the fingernails, since pathogens and dirt can collect under there. And while you're cleaning your hands, point your fingertips downward so water doesn't run back. And when you're done, turn the faucet off with a dry paper towel. Waterless hand cleaning with an alcohol-based gel, lotion, or foam is also an effective way to prevent the spread of organisms. Use if your hands are not visibly dirty or contaminated with blood or body fluids. The hands should be rubbed until dry for at least 15 seconds, and after 6 to 10 cleanings, the hands must be washed with soap and water. Many procedures require the use of sterile techniques to prevent patients from infection. Surgical asepsis keeps an object or area free from living organisms. To be sterile means to be free from all organisms. The sterile field is the area that is used for placement of sterile supplies. It needs to be free from clutter, and sterile items must never touch a non-sterile object. You must never reach across a sterile field, nor turn your back to the sterile field. Avoid coughing, talking, or sneezing over a field. The 2-inch border around the sterile field is considered contaminated. All sterile items need to be checked before use. Observe agency guidelines for dates, and it's necessary to keep sterile field dry. Methods for removing items from sterile wraps. The drop technique is holding the package upside down over the field and then dropping whatever's inside without touching the inside. The mitten technique is when a mitten is formed from the wrapper and it's wrapped around the hand while the hand is holding the item through the wrapper and never touching the item. And then the mitten hand is used to place the item on the sterile field. And transfer forceps is when sterile gloves are worn. Someone else can open the package, so you can grab the item with forceps while you're wearing sterile gloves.